Hello, Namaste. I welcome you all to the 90th session of GURUBODHA. Welcome you all to this session. And we have with us today Dr. M.B. Guraja sir and Dr. Rajinikanth Patel sir with us on behalf of us, all of us students. I cordially welcome Dr. M.B. Guraja sir to this session. Good evening and Namaste sir. And I also welcome Dr. Rajinikanth Patel to this session. Good evening and Namaste sir. So this session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. This class is made live available for Easy Ayurveda weekly class subscribers. To subscribe to our weekly classes, please go to easyayurveda.com/video-classes. So with that, we come to the topic of the day. There is a question which we were not able to answer in the last session. And the question is, we generally keep a first aid kit at home for accidents. What would you recommend as a good Ayurvedic first aid kit comprising medicines and home remedies for general health issues, namely fever, cough, indigestion, constipation, gas, headache, etc. My initial, to kickstart this topic, first aid kit comes to mind along with, say, emergency situation. Guraja sir, first step before we get into the what medicines that we can take or we can prescribe, etc. The critical decision that an Ayurveda doctor has to make in his clinic is whether he can manage the condition with Ayurveda or whether it is wise to refer. So that decision sometimes becomes very critical for the best interest of the patient, sir.
See, first of all, we should understand what is the term, the meaning of a first aid. It's only an initial health-related approach to a condition wherever it happens and as an accident. It may be any accident at the home or in the kitchen or in the garden, anywhere. So something goes wrong or it might have caused some wound, some cuts, some bruises, or suddenly there is a cold catching in the night itself, suddenly there is a catch in the chest, something like that. So all those conditions wherein what at the level of a doctor or at the level of a general common public, what can be used as a first aid, an initial approach to handle those conditions. So in this condition, whatever it can be done, it is only an initial one till the person reaches the doctor's clinic or hospital, whatever it is. If it is in a grave emergency, it is rushing to a nursing home or anything which for the emergency management, it's a must and should. We cannot say that everything can be handled through Ayurveda. There are certain issues, certain information, medicines has to be given, injectables form of it, and we are lacking in that. And unnecessarily, just for the sake of the name of Ayurveda, we want to do it, it may become counterproductive. So we need to assess ourselves that where we can use them. For any general problems like cough, cold, fever, or headache, or even cuts, wounds, burns, something like that, we can manage with certain things, and plenty of our first aid things are available at the kitchen itself. If you got any problem related with the cold, we can have a fresh ginger, crush it and taken some few drops of it, add with little bit of Gouda and consume it, or you can directly pour into the nostrils. It can even very strongly, it can relieve the congestions. So many things are there. It can be done like honey. We can use it for any sort of burns or wounds, for dressing, turmeric for any wound healing or any there is a bleeding to stop it, or even any itching is there, or untoward, intolerable itching is there. Some soothing agents like aloe vera gels. So all these can be a part of our first aid kit, which can be taken. Or any digestion related things, if you have got any something like that, hinguastica tablets, so that can be taken for a gas related issues, or even antacids like containing any Pravala Basma or anything like that, or even the Pravala Panchamrita in a milder form, or even few tablets of Kamaduga. These can also be taken. But of course, when these things be taken, it should be under the guidance or the advice of the Ayurveda physician. But at the level of strictly at the level of general public, when we are dealing with certain issues, like for example, there is a cut or a wound, injury, wash it cleanly, apply haridra or even the aloe vera gel or even honey based on that, smear it, make a little bit of bandaging, that will be sufficient to help it curing. So This type of things, wherever demand is there, accordingly we can do it. But only the thing is, it should be a first aid. It not should not be beyond a certain limit, and it should not become a treatment course, a main treatment course. Main treatment is entirely different when compared to the things. It's only an initial approach to hold the situation.
Thank you, Desa, for making it very clear that first aid is just the say symptom-wise management, just to stop the initial bout of whatever the patient is complaining of, and it is different from full-fledged treatment planning. And with that, another important point that you told was that we should be very careful, and we should be deciding, as an Ayurveda doctor, we should be deciding what we can handle, what is in our hands, and what is not in our hands. And we should never be there's no shame or anything in referring the patient to a higher center if he cannot handle. It's perfectly fine. There's nothing like pride or ego problem we should not be having. We should be doing for the with the best interest of the patient. Now I'd like to welcome Rajinikanth sir to this session. Sir, I just muted you because there was some background noise. Your initial thoughts on first aid, then later we can go disease by disease or system by system. How do you have like a first aid kit, or what is your approach for the first aid?
I will go with the same inputs of Dr. Guru Raja sir. The first aid kit is the work we should do till the actual help arrives to us. For example, if any emergency has occurred to us, first and foremost thing is to call the emergency. That it 108 or police or whatever the case related. First, we should call the emergency team, and then what we do till the actual team is arrives, I think that should be put in the first aid. Same Guru Raja sir told, not the main treatment, but what we can do till the actual help arrives to us. So that will be the first step, and it won't be the actual treatment, as Guru Raja sir said. And in few conditions, we can use Ayurveda, but in other condition, I think we can't handle all the emergency. Normal things, as Guru Raja sir told, what and all are ginger and honey. Turmeric is available with us when there is a wound or there is a cutting marks or the bleeding is there. So like that. But I would like to add some few medicine to be kept at home for general. For example, we can use Mahasudarshan Ganvati in home, Kilo Sattva. So what I observed is when there is a high grade fever, in spite of giving the Mahasudarshan Ganvati twice or thrice a day, I advise them to every half an hour or every hourly, depending on the condition the patient has. I even gave the 10 tablets per hourly to reduce the fever in emergency condition. No doubt, we have to take the help of modern medicine, but high dose of this Mahasudarshan Ganvati or Giloi Sattva brings down the fever. Where we are in remote place, where we don't have any medical store very far, or we don't have anything, that should be carried away. That should we should carry. Then also Trikatu we have in our home, that can be used in cough cold. And one important this formula I have found is when there is a nasal congestion, emergency nasal congestion, I give the Haridra Dhupana. So everybody has this roti preparing this tawa. So I advise them to make a hot of this tawa and sprinkle the turmeric powder on it. So the smoke which comes, patient has to inhale that smoke. So patients feel very much lightness in the congestion. So very good in the case of a nasal congestion emergency where in home. Then for indigestion, we all have rock salt, this black salt in our home, hing we have in our home. So that can be used as already Guru Raja sir has told. One more thing I would like to add this, we should keep a madan phal in our home, in kitchen. So anytime by mistake, if we consume any bad thing or wrong thing by mistake, to induce vomiting instantly, we should use this madan phal in our home. It should be kept in our this kitchen. In Gujarat, there is a when marriage is happening, the male has to bring a madan phal here throughout the marriage. So, in case of somebody tries to give this husband, this male, or some wrong food he is taking, means Madanfal is already with him. It is tied here with Katri. So immediately he has to take the Madanfal, and within few minutes he gets this vomiting. I think this will be helpful if we keep Madanfal in our home when we take some wrong food. So this is my inputs here.
Very interesting thing about the bridegroom taking Madanphala to the sun, just to avoid any accidents. Yeah, I mean, this inhalation of fumes, Dhumapana, we have learned from you in your mucormycosis, this one that you use it very frequently for various disorders and so on and so forth. So let's just go situation by situation here. I'm just covering as much as possible here. So first one is a road traffic accident, and a person with say bleeding comes. Guraj sir has mentioned about like turmeric application, etc. In a clinic level, do you do anything to manage or stop bleeding, sir, or referral is the way to go?
See, whenever there is a road traffic accident, a patient approaches us, it is our duty to observe what and all the tissues are damaged. It is our duty to assess that whether there is any head injury or not. That is a very, very vital. Second thing, whether it is simply bruises or any vessel is been cut or not. If it is simple bruises, we can treat it as a first aid, clean the wounds, dress it with the whatever the gel available, maybe of some gel like Panchavalkala lepa can be applied, and ointment can be applied, and that is can be done. But being it's a road traffic accident, we don't have anything to stop or prevent tetanus in any such type of things. So in order to avoid that, because if it's a patient life is at risk, we can't just simply because it's Ayurveda, I won't give it. No, we need to refer to such a place where he can take the primary shots of tetanus, because it's a road traffic injury that needs to be addressed in a right manner. That is the one thing. Second thing, if it is any major cuts and wounds or where is a clear-cut bleeding is there, then the pressure bandaging has to be done and later is to be sent to the higher center for further management. If it is a simple one, we can with the pressure we can clear the things and even avoid the bleeding. But if it is a major one, it is better to send it to higher centers with some pressure bandages. Then regarding the wounds in a particular area, then we can clean it and apply all those local anti-infective materials like aloe vera gel, even haridra gel, something like that. We can be using it, and panchavalkala lepa, something like that. We can use it. It will going to help the things to clean the wound, and it helps in easy healing. Even many other Jatyadi Taila applied, and even the Jatyadi Gruta can be applied. Dressing is done, even Kashidadi Taila, even the Ropana Taila can also be applied at that level. But we need to assess whether it is clearly a road traffic accident or patient is just bluffing it. There may be some fight or injury. It may be a medical legal case. Unnecessarily we are handling it. Then it comes to a risk that we may go to the court for other things and even to the police station. So we need to be very clear in this. If it is a clear-cut road traffic accident and where we can handle, only those type of things or wounds should be addressed, not everyone.
Thank you, there, sir. And very important thing is that in the medical legal case, if we get over involved, then we may be like summoned for proof as witness in different cases, etc. So we need to be very careful with all the patient consent form and so on and so forth. And wound care and its management. Rajinikanth sir, do you have any further addition to this, please?
First of all, same again, I will go with Guru Raja sir. First and foremost thing is medical legal case. When there is a road traffic accident, we should also confirm that patient or their relative is telling true thing or they are speaking lie to us, because sometimes some attacks has happened and they will show it as some accident. So we should confirm it, and if possible, we should also take a consent. If we are planning to do any treatment in our clinic or in our setup, we should sign a consent from there. If we have a bigger setup and we are planning to do some treatment, then we should take a medical, means we should inform to the nearest police station that such kind of injury has happened and this patient has come to us. Then again, same as Guru Raja sir, otherwise we could be in trouble. We have to go to court and police station to give the answer. Okay, so this is the legal issue. Now, anyhow, we don't have many things or a few things to do with Ayurvedic medicine in such a road traffic accident case. But as I told, till the actual help arrives to us. For example, near to our clinic, some accident has happened, then patient will come to our hospital or our clinic only. So first, we ask the relatives to call the ambulance, 108 or government ambulance, till the ambulance arrives. That time we should do the treatment. If there is a wound is there, as Guru Raja sir tell, we should clean with Pancholical path. We can apply Jatyadi Grut or Shatadot Grut we can apply. Or any major injury is there, we can use Arjun Churna application or Haridra Churna or any Kashai Ras Churna. It is not that Haridra is available, it is best. But if Haridra is not available, any Kashai Ras Churna which is available in our hospital, we can apply, because Kashai Ras will do the Stambhana. Now, coming to the Ayurveda, what I have observed is, actually we should not do this in emergency. The patient comes to my hospital when there are some issue. I have written some point. For example, there is a unconsciousness is there. Murchit avastha is there. When we read this Shwas Puthar Ras, Falsuti in Bhaishya Ratnavali, it is being told that in Sannipata Vyadhi, when predosha is getting provocated and any disease, when the patient faints down or patient become unconscious, we should give the Prathaman Natsya of powder of this Shwas Puthar Ras. So we practice this in our hospital also when such things happen while patient is there in our hospital. Another thing, we should check the pupil of the patient when there is unconsciousness there or conscious. Pupil is reacting to the lights or not. By this, we can get the idea of how the brain injury patient has occurred. Also, we should check the bleeding from the ear, nose, throat, or these eyes to check the internal hemorrhage is there in brain. So accordingly, we can quick the treatment, or we can quickly call the ambulance service. So this will be the my point. Another thing, what I have observed is when there is a brain injury, there is a bleeding in the brain or infarct or hemorrhage. That time intracranial pressure rise too much and patient feels vomiting, or some kind patient feel become unconsciousness. We forget unconsciousness because we can't administer oral medicine in unconscious patient. So Dhanadhanyadi quartz that I have found, it reduce the intracranial pressure. So this is the research area where the researcher or we Ayurvedic doctor should involve in this emergency care if Ayurveda really can help. But what I have found in the general patient, for example, tumor is there in brain, space occupying lesion is there, or in any condition, meningitis is there, CSF leakage is there, where there is a high intracranial blood pressure, we administer the Dhandhanya Quath in a high dose. And within second or third day, patient feel very lightness in the head. So this can be used. And also if there is a spine injury, in a road traffic accident, then it is told in modern medicine that we should not move the body because it will further cause the injury to the spine. So this is my input in this road traffic accident. What Ayurveda can do. Actually, very little we can do, but these are the subjects of research. So research area where this can be studied more.
Thank you there, sir. Guru sir, please.
See, first of all, emergency. We need to understand what is emergency. For a homemaker or a person, somebody, the child has just cut a little bit of little finger or something like that, and there is a bleeding. It's an emergency for a homemaker because she is not exposed to the conditions of medical conditions. From the point of view of a doctor, that is a simple injury that can be easily managed. So that's the reason we need to understand, even as an Ayurveda doctor, we need to understand that what is emergency, what is the level of first aid, and what needs to be given as a treatment protocol planning. The moreover, see if you are a Ayurvedic doctor, you are in some remote place for some purposes, you are gone, you don't have any access to any of these medical kits or any first aid kit. Suddenly there is a wound because of some fall or something like that. Then we need to clean the wound. Water is available, clean the wound. Then try to find out at least these two plants if it is there nearby. One is Lantana camara. The other one is Tridax procumbens. If these two plants, if you could able to, then the leaves of these plants can be taken and crushed and maybe applied to the wound. It immediately acts as a styptic and as well as it's a very good wound healer. So this can be done.
And this Lantana camara is so very common.
Yeah, very common plant.
Yes, and I think it grows on the sides of the road also.
Everywhere, wherever there is empty places, unused places, it everywhere it grows and requires less water, so it easily grows in every place.
What is the Sanskrit name, sir? This
Sanskrit as such, there is no name for this. We need to keep a coin term for this. Say for this Tridax procumbens, the one of the name kept for this coin term is Dandotpala. There is a Utpala with flower on a big Danda one. That's why it's called as Dandotpala
Okay.
coin term.
So, and yeah, before moving further, I wanted to ask Dr. Rajinikanth Patel that you have you have intensive care unit in your hospital ready. In one of the other personal conversations, you said that you have intensive care unit, ICU rooms in your Ayurveda hospital. Can you please
no, it
explain
is
more like how do you manage or what are the equipments there?
it is not there currently in our. But we are expanding in next month, and we are planning to have it. But we have some collaboration with our modern doctors, where we keep the patient in their hospital under their physician care, and we also administer Ayurvedic medicine. We parallel work. As of now, we are working in this setup, and within a few months, next month, we are expanding our hospital. There we have such a plan. As of now, we don't have, but definitely we are treating the patients in ICU with collaboration of some of our friends.
Yeah,
Definitely, that will be a very good idea that we will have an integrated approach to many conditions, and automatically the area of our service will increase.
yes, sir. I mean, yeah, probably integrated approach is the way to go. And this is Medanta Ayurveda
In
Hospital.
Gurugram, yes, they have like this
Yeah,
specialty.
yeah, in Gurugram, it is integrated. And I
In
think that,
Ahmedabad also, HCG, this hospital is a very huge infrastructure. There also they have combined approach. Tapan Vaidya sir is also doing consultation there.
yeah, and this one, Mata Amritanandamai is a big hospital has come like with 600 plus doctors, etc. I think in Faridabad, I think. So that contains both Ayurveda, yoga, from every facet as well. And
It is
now,
need of an hour. It is need of an hour to work together.
yeah, and now Apollo Hospitals, which is like out and out a modern company like allopathic company with the pharmacies, etc. So they have bought 60% share in Ayurveda.
Ayurveda they have bought, yes.
Yeah, so it's all coming together. Probably the integrated approach is fast approaching, and that will save many lives. And we also get a chance to work with them, work with allopathic counterparts, and they also get a chance to see the flavor of Ayurveda. It's a win-win situation for both of us, and more importantly, to the patients as well. And someone has written here, Tridax in Telugu is called as a Gaya Paku. We use a lot when we were young while playing kabaddi, etc. So again, it has that Gaya Paku. Probably wound healing is there in the meaning of it, and yeah, everyone has.
Gaya Paku means wound healing herb.
Yeah,
Paku
so
means herb.
yeah, so such a beautiful word. HCG or HCG, probably it's HCG. I'm not sure. So okay, taking the conversation forward. Next is like a gastroenteritis with vomiting and diarrhea. It could be food poisoning, or it could be excessive alcohol consumption. It could be like a mithyahara, or it could be like a serious case of poisoning, which sometimes the patient has taken poison, but the other people around him or her, they do not know that it is a case of poisoning. Lot of things to take care here. Guru sir, your inputs on this.
Definitely, when any acute case of gastroenteritis comes, we need to examine that, or we need to rule out that it is not due to the poisons or any poisons the patient has consumed, maybe voluntarily or accidentally consumed. That's the point number one. Second thing, we need to go for a little bit of extra information depending on the type of the case, or we should also have updated information about the localities. Any outbreak of typhoid or any outbreak of viral hepatitis is there, that needs to be known to us, as many times it so happens when there is in rainy season, when the contamination of the sewerage lines, sewer lines will come with the contact with the drinking water line, or maybe due to them damages. So such type of viral outbreaks are very common, and that needs to be taken care of. That information should be there. Then based on that, we can go for it. Many times, severe Acidity can also cause vomiting and chest pain or something like that. But whenever there is a vomiting, diarrhea, and other lakshanas are there, we need to just look for simple food poisoning, or it may be due to typhoid or cholera, whatever it is, that needs to be taken care of.
Yes, sir. And assuming that all the things are ruled out, and if the cause is from the gastrointestinal tract itself, and it is due to say amla, out of control amlapita, etc. What medicines would you think?
Definitely, if it is a severe acidity, then to cool it off, we need to go with Madhifala Rasayana and Kamadukha with Mauktika. That is my choice. Madhifala Rasayana with Kamadukha Mauktika.
I found this Madhifala Rasana a very great medicine. I misprepares it, and now many other companies have also started preparing it. Even if it is case of last night patient went to restaurant and had different types of variety of wrong food combinations, and then now he has or arising due to this one. Either it nullifies the symptoms, or it makes the patient to vomit. In either case, it's such a beautiful it gives almost instant patient relief, like within 1 to 2 hours.
See, definitely, whenever after consuming certain foods, or maybe because of combination, or maybe because the dose, if you are feeling somewhat nauseated and you are unable to control these things, and if there is a issue with that, my sincere suggestion is to vomit it out. And easy way to vomiting out is just to put your book finger directly into the mouth. Doesn't require any of your product to be kept in mouth, or you have to take some medicine to vomit. Straight away, just put your hand and the things will come out, and try to vomit out entire thing so that the stomach disturbance will be totally relieved. Because once you vomit out, then there will be no issue. But if the wrong food or whichever is taken yesterday, it's already crossed the intestines, or gone down to the intestines, then we cannot make it, vomiting is not possible. Then only thing is to make it go out as far as possible. Sometimes that's the reason Ayurveda Acharyas have very clearly said, Ama Atisaram na Stambanam Arhanti. Very clearly said, when there is Ama in the Atisara, you should not stop it, allow it to go. It's a very clear statement they have made. Then only we can go for the Stambana later by Agnivardhana and all those things.
Yes, sir. Such an important thing that if it is an Atisara with all the causative factors etc. established, do not go for samana as Richard said. I mean Agnidipana, and I think Tarpana, there it is mentioned, and then if only if the need be, and if the patient is very weak, then the samana is deployed. Gastroenteritis with the digestive tract causative factors. Rajinikanth sir, please.
As sir mentioned about vomiting and all, and also to know over the locality which disease are more. For example, nowadays conjunctivitis is more, so patient come for conjunctivitis, we know everybody is having. So like that, typhoid, dengue outbreak, is there any cholera outbreak? So that is the important things Guru Raja suggests. So when there is a severe gastroenteritis, when there is a dehydration of the patient, I am just talking about emergency treatment at the clinic or our setup, not in the our home. So we should check there is a severe dehydration is there in patient, or patient is hydrated. If we found the patient is severe dehydrated, the Madhu Siddha Jal or this Buddha Siddha Jal, this can be given in Trishna Chikitsa, it has been mentioned. So this can be done at home also, and in this clinic setup also. When we found there is too much dehydration is there in patient, it means Trishna is there, too much Trishna, water loss is there. Then we can give Madhu Siddha Jala or Buddha Siddha Jala. That is the one point. Another is, sir has told, when the too much severe diarrhea is coming with us, so we should first confirm that it is Amati Sara or this Niramati Sara. If Amati Sara is there, means stool will be floating, sinking. Nirama means there, means stool will be floating. So this we ask the patient tell, okay, it is Niramati Sara, we should try to stop the loose motion. If it is Amati Sara, we should give Ampachan, Dipan, etc. And there is no ama is there, we confirm in Atisara, we should use the Kutaj Parpati, Kutaj Ganvati, plain Kutaj Churna, Kutaj Arista. Those we can decide after seeing the Rogi Bal, Rog Bal, etc. Also, we should use this when there is a udar shul adgana is there. Along with this, we should apply the hing on all the lower abdomen area. Little bit warm in til tel, and we apply the this hing on the abdomen. When there is a patient has vomiting, in spite of giving this MSET and pantoprazole IV, or patient is still not having relief in vomiting or still reflex is coming, then what I have found very useful is I give Shaddharana Churna 4 to 5 pinch every 15 to 20 minutes. Take a Shaddharana Churna in hand, add little bit honey or ghee and lick it and swallow it with saliva very slowly. इधर से घिस के जाना है पूरा शड्डारण चूर्ण ये धीरे धीरे इट्स लाइक अ लेप ऑफ द इसोफेगस so slowly saliva के साथ means with saliva शड्डारण चूर्ण we should it should be going inside either we can use शड्डारण चूर्ण or मयूर चंद्रिका भस्म every 15 to 20 minutes we have to lick it with saliva and slowly it should be go inside. Sardi Ripuvati also we can use when there is uncontrolled vomiting or nausea.
Sorry, which vati? Yes, I missed that.
Sardi Ripuvati. Sardi. See, and important to do which chikitsa in this gastroenteritis case. So when we check the modern science, most of these symptoms occur due to the toxins released by some specific bacteria in the gut flora. So oversensitive to flora it will become. So it will either start from downwards or it will start from upward. So in such cases, which chikitsa is also important. We give Dushi Vishari Gulika, Vilvadi Gulika, Shirish Churna we can give if available. So which chikitsa in the gastroenteritis case is also a must rather than just focusing on this and this all. So these are my input on gastrointestinal tract related this issue. Sensitivity also can be given. It is indicated in Ajirna also.
Yeah, and there are some questions here. Can Shaddharana Churna be used in case of pregnancy-related vomiting? Before I bring in Guraja sir to this, Shaddharana Churna is mentioned in Sushruta first, and
indicated for Amashayatvat.
Guraja sir, can this be used? I think it contains Chitraka.
No, I think it is not advisable. In pregnancy, we can use Mayur Chandrika Bhasma. It is very safe in pregnancy.
Pregnancy-induced vomiting, you have got Madhifala Rasayana. You can take it in a very good quantity. It will give you even Madhifala Rasayana as well as Matulunga Rasayana. Both are available. Almost they are similar. Can be taken.
Yeah,
Mayur Chandrika Bhasma can be okay in the pregnancy because it is Chitraka and Ativisha.
It's also good. Nothing to worry about that. It can be taken.
Yeah. I mean, there's this one comment on integrative approach is great, very much needed. Several of the patients are experiencing problems convincing allopathy docs to treat Ayurveda alongside allopathy. More power to it. And I realized that this integrative approach is very prevalent in the USA. That there are many institutes in which the allopathic doctors are working hand in hand with naturopathy people, physiotherapy people, etc., to give comprehensive healthcare to the patient. How to prepare Madhu or Guda Siddha Jala? I already wrote the formula there. Madhifala Rasayana during pregnancy, usually 1 to 2 teaspoons twice or thrice a day is the regular dose. Do you suggest any Anupana with Shaddharana Churna? Because of its taste. First of all, Churna is the mentioned one, and Shaddharana
Tablet is available.
Shaddharana tablet of avian is available. Even
many companies preparing it.
Even Shaddharana DS double strength is also available. Any Anupana specifically to this, Guraja sir, please?
It can be taken with honey, no issues.
Yeah.
Even directly can be taken.
Even Madhifala Rasana can itself.
Yeah.
This will be a good combination. Madhifal Rasayan with Shaddharana.
Yeah. Somebody else asked, can you name the institutions using integrative medicines in the US? I do not know specifically which medicine, but we had a nurse who works in one nursing home in Pennsylvania coming to us. She told in detail how integrative approach is there, and she's going to introduce Ayurveda in her nursing home because the doctors there are very open for it. Probably in the state of Pennsylvania, it's allowed. I do not know much about it. Okay, and status asthmaticus or severe case of asthma when the patient is especially coming with wheezing and with the difficulty in breathing. I mean, difficulty in breathing itself is a wide topic, especially post COVID. We need to be careful assessing the patient. And if the patient is a known case of asthma and he or she comes with wheezing, then what can be done at the clinical setup level? I'll go, let me go with Rajnikant sir first in this case.
So it is when we are running Ayurvedic hospital, definitely we will have all the Anuvachan Nirubasti material ready in our hospital. So what we have observed in this Pranava Srotasvyadi, when there is a severe dry coughing is there or episode of this asthma, we give this Nirubasti. We don't follow the classical one, Maxicum Lavanam Sneham, but we use the ready-made quath which is prepared in our hospital for other patients. For example, Maharashnadi quath is available. We take 1 liter of Maharashnadi quath, we add a little bit Saindhavadi tel and lavan, and we immediately give the Nirubasti to the patient immediately. So majority of the patient feels good after the nirharan of this Nirubasti or the Mala is occurred. So this is the one point what we use in our hospital. Severe dry coughing, patient has tried everything, but dextromethorphan, everything they have tried, but still not this happening. Means we give the Nirubasti, whichever quath is available. We add a little bit of Sneha Dravya. Sneha we can use. If nothing is available, we can use a Tila Tela, black sesame oil, and we can give the this Nirubasti instantly. And majority of the patient found good effect of this. Another thing is we should have 64 64 Prahari Pipali. In Gujarat, it is very famous that the Pipali Churna should be given Bhavana of Pipali Quath for 64 Prahara. It becomes the 64 Prahari Pipali. Many company prepare it. It is we should give this 64 Prahari Pipali with this Madhu, Muhur Muhur, because it is the thumb rule that in Pranava Srotas Vyadi we should give medicine Muhur Muhur. So, for example, every 5 to 10 minutes, 2 pints of this 64 Prahari Pipali with honey we can give, or we can give Kanaka, Arista, 4-5 drops and 2-3 tablespoon, 2-3 pinch of this Pipalichum. So this will be a good choice. Also, we have this Swas Kuthar Ras, Prathaman Nasya. We can give. Before starting treatment, we should also confirm that this is the case of regular asthma, or he has consumed anything, and due to that poison also some has this breathing difficulty. So we should first make sure that this is the case of old or known case of asthma or like that.
Yes, sir. And I mean, in this Nirobasti, like out of all, why did you how did you come? Sandhavadi Taila and Lavana, it makes some sense, but why Maharashtra Quath? Or is it?
No, I just give an example because I use Maharashtra Quath in majority of the Vatyadi patients. So it will be ready-made available. The once patient came, within few minutes we can administer. We can use Dasmul Quath. This is just example I have. Because whichever is to you, we can't wait for 1 hour or 2 hours and arrange everything and then give like that. And also this Abhyang and Swedan. If this asthmatic attack happens in home in night when nobody is there, we should just take a oil whichever is available in kitchen. Just do the snehana in Parshva Bhag, Uras and the Pushta Bhag, chest and back. For few minutes we do Abhyanga and then give a steam. If steam is not available, make a cloth warm on water and then apply only. So by this also many patients feels good. This can be done in hospital also and in this home also. In hospital we are doing, then it is best to use Saindhavadi tel for Abhyanga on chest, and then we give the Nari Svet. So this also helps.
Sir, yes, sir. Guru Raja, sir, please. In case of asthma, what could be done?
See, first thing is I'll make this approach of a treatment at two different levels. One is at the level of home. The other one is at the level of a clinic or an hospital under the guidance of an Ayurveda physician. At the level of home, what can be done for particularly? First thing, one has to clearly make note of it that this episode is a regular type of one and which has come as a routine thing, maybe because of winter, maybe because of some infection, or some because of some fumes, or is habituated and a family has a history of asthma and such things. If it is there, then it can be handled at the level of home for a temporary as a first aid measure. In that, what what we do is putting some Amritanjan type of materials or something like that, or even the Zandu balm type of material, applying on the chest and giving a hot water bath or even the tepid sponging, we can call it as, that can be given. The second thing is, if you have got any eucalyptus oil at home, that can be made to inhale by putting it in hot water and take it as a fumes. These things will help, definitely will help. This is the one point. Secondly, if this is a clear-cut status asthmaticus or a very severe onset, and patient is known regularly consuming the medication, then these primary efforts will not yield any things. Then the patient should be rushed to the hospital. And definitely, when they approach an Ayurvedic doctor, because many a times I have seen, usually they will approach an allopathic doctor. They used to take an injection of many other molecules. They find it easy. But nowadays, many times, many patients complain that while taking injection, the things will settle down. But later, I got a lot of vibration in hand and another difficulty will arise. That's why we don't want to go for that. You give me Ayurvedic treatment for that. And in such type of patient, the first approach would be, if it is a severe nature, then definitely the first approach would be Bruhat Shwasakasa Chintamani. Bruhat Shwasakasa Chintamani, crush it together with Talisadi Churna, Karpuradi Churna, and it is taken, or along with that, Vasakarista Kanakasava. Vasakarista Kanakasava. This will definitely act as a bronchodilator as well as a mucolytic. It expels the kapha from the shrotas, pranava shrotas, as well as it also makes the bronchodilator effect. Thereby, the air entry into the pranava shrotas will be more and patient will feel comfortable. And at the next level, if it is not such severity is there, but there is a risk, then we have got plenty of combinations available. Like one of the best combinations what we can use it, Shwasamritam syrup. Shwasamritam syrup. Daturadi Kwata. The Shwasamritam syrup is from, I think, Chamundeshwari. Chamundeshwari. It's a wonderful one combination. And Daturadi Kwata is from Pentacare. Then we have got Bronchomed capsules, which can be consumed. These are very Bronchomed and Daturadi Kwata is from Pentacare. And of course, Vascarista, most of the companies produce. Even Dashmularista is also good. But still, another one important thing, if you want to keep it as a first aid in home for this is, Nagarjuna company produces one capsule-like thing that is called as Haline. Haline, that is just cut into that and it is put into a hot water, or even to the kerchief, then it can be smelled, or it may be taken as any oral inhalation, inhalation, something like that, or the hot vapors, something like that. That also gives you wonderful relief.
Yes, and I've seen like most of the modern people who are using these decongestant capsules, and then Carval Plus is there. They're all just Ayurvedic basically, wrapped in modern medicine like eucalyptus, camphor, menthol, thymol, so on and so forth. Yeah, and Talisadi and Sitapaladi Churna, are they good for general this one? What is the difference in usage? Probably we'll take up in this one. It's one of the very basic
I
questions.
can add one basic thing. Talisadi in wherever there is a kaphaja things, and Sitapaladi is wherever the pitta or irritation type of thing or the vata is there. There's a basic thing. There is a dry cough, you can use Talisadi, provided the person should not be diabetic, and wherever it is a kaphaja or anything like that, then use it Talisadi or even Karpuradi.
Can Swasamritam be used in dry cough condition due to Vata aggravation, sir?
Definitely, Shwasamritam can be used in dry cough, productive cough, smoker's cough, wheezing, and all the conditions because it got a plenty of ingredients in that.
And related to this one is that excessive uncontrolled sneezing. Somebody has asked, so for uncontrollable sneezing bouts, what can be the primary aid?
Tablet Histantin, Haridra Kanda, and tablet Isinofol.
These, and it's a little bit controversial, but Histantin and eosinophil, they almost got Suktin, probably another one, R compound. They almost become like classical medicine. We can just put a shloka and add into.
Haridra Dhupana in home when there is excessive sneezing. You just take तवे पे वो हल्दी का डाल के like that it will help. It is very good results giving.
Definitely, what Dr. Rajnikant Patel has said, that's a wonderful one actually. Putting directly Haridra to on burning charcoal or something like that, or even on roti tawa and taking a fumigation, It's a wonderful one. Definitely yields immediate reliefs. It will give you a wonderful result.
Yeah, probably, I mean, this Dhupana or fumigation technique, most of us Ayurveda doctors need to incorporate more and more. Thankfully, I learned that Guru sir was a big proponent of that when I was doing the BMS, and Rajnikant Patel with his mucormycosis presentation refreshed my knowledge on that.
And
Okay.
definitely, he has given a very good mode of poison. Previously, I used to put it on charcoal, burning charcoal, or something like that. But I got always some sort of in my mind that even while inhalation, it may be even carbon dioxide is going inside. What to do? I was thinking that how to overcome it.
It will
That's a wonderful thing on a roti
make
tawa,
irritation.
and taking is it's a wonderful thing. What is suggested?
So, yeah, sticking with Dhupana, Rajnikant sir, do you have any more? This one, I mean, one is the turmeric. Any other combinations that you use regularly need not be for asthma, for various cases.
In majority of the pediatric patients receive Trikatu Dhupana. They are being treated as per the guideline of Graha Chikitsa. I think all patients below 2 or 3 years of age, children, it is a must for Trikatu Dhupan to hold the body, on the whole the body.
Even Guggulu, Haridra, and Twak, they can also be taken for that, and that also gives you very good relief.
In fever case, uncontrolled fever, where patient had tried many allopathic hospital, but fever is still not unknown cause of fever, then we give them Palangashadi Dhup. It has to be done in their room where the patient is staying. Palangashadi Dhup.
Palankasai is a...
There is a ready-made, it is available. Then there is one Rakshogna Dhup. I think Sarthra or some South company, many company preparing this Dhupan. So this in fever case, malaria, dengue also we can give, and patient feels very good.
Recently, during COVID time, Aparajita Dhupa was new thing they highlighted.
Yes.
Yeah. This is originally mentioned in. Let me just take it. It's very interesting. It's first mentioned in Ashtanga Hridayam. Aparajita Dhuma fumigation. This is from Ashtanga Hridayam, Jwara Chikitsa treatment of fevers. Aparajita Dhuma to win over all of the fevers, especially Agantuja type of fevers like germs, viruses, psychiatric factors, poisoning, injury, etc. So Pura, Dhyama, Vacha, Sarjara Savatiri, Indica, Neem, Arka, Calotropis, Agaru, Devadaru are the uses. So yeah, another one, and during COVID times, this became very frequently used in majority of the hospitals.
The one comment about this Dhupana, when there was a second wave where it is a peak level of COVID case, the Ayush department from government of Gujarat, they came to Surat for opinion of Ayurvedic doctor. So I have advised them, why not you plan a big Dhupana in the society, every society. So they told, no, you can't do this. Allopathic doctor will say, oh, what happened to the asthma patient, what will happen. So then I told, you don't do then. But this is the idea. If you do, you might get some good results. You do Dhupana, how the Surat city.
Which specific Dhupana were you suggesting, sir?
This only, Palankashadi Dhup.
Palankashadi. Okay.
It is in, I think, Visham Jora, it has been mentioned, I think. One day to come when all the area needs to be, because this is...
Okay, yeah, and I mean, there are a lot of questions, and there are also, too many subtopics under which we have not covered, like migraine, headache, breathing difficulties we haven't covered. So some more things are left out, and poisoning is another one. And there are some more points and some more questions which were asked, which will not be able to take up this week. This conversation will continue further in upcoming weeks. Probably we'll keep an emergency medicine topic for like 10 minutes in as one segment, and then we cover other topics also further. Thank you all for your interesting questions and chiming in with your inputs in the chat section, etc. And on behalf of all of us students, my words of gratitude to Gururaja sir. Thank you, sir. This really boosts the confidence. I mean, everybody learns all the theories that, pranavashotas, kaphavata, hara and all, but we sometimes do not get to know what actually medicine, in which way we have to use. And, Guru sir was the first source of confidence and a wall of strength for me that, yes, this can be done and these are the medicines to use and all. Theories we can just study ourselves or taught in the BMS, etc. But the practical is where able gurus like Guru sir will help us a lot. And Rajinikanth sir, as always, pleasure to have you again. Thank you all. See you all. Namaste.